Good morning from WKYT News. I'm Bill Bryant. We certainly hope you're enjoying your weekend. Later, we'll hear from Governor Steve and First Lady Jane Beshear as they wrap up an 8-year whirlwind in Frankfort. Our Jennifer Palumbo talked with them at the governor's mansion. It's all decorated for the holidays. That's a little bit later. But first, after a lifetime in public health, Dr. Rice Leach is nearing retirement as Lexington's public health commissioner. He was also the Kentucky health commissioner statewide. Dr. Leach has always been frank and candid, sometimes blunt, about how people can take better care of themselves. The Lexington Health Department has operated a needle exchange for the last few months. We'll ask him how that is going in the effort to limit the transmission of disease. Flu season arriving. Many still have not been vaccinated. Actor Charlie Sheen's revelation that he has HIV has renewed interest in testing and treatment. And a new report this week reveals a major spike in sexually transmitted diseases in this country. Dr. Leach is with us this morning. We thank you very much for coming in.
Thank you very much.
And I have to say it is bittersweet because we've always enjoyed the fact that, as I said, you've always been candid. You've always told us what you were thinking and how people could improve their health. But you have some reasons now that you have decided this is a good time for you to step down.
Well, I'm 75. I've been in this since 1964, if you include 2 years of medical school, and I have developed lymphoma, which is not responding as nicely as I would like it to. And so I told the board at a meeting not long ago that I thought they would be irresponsible if they didn't get on with a succession plan. So they've hired a firm to recruit for my replacement. And I tell people that lymphoma is a concern, but hanging it up after 52 or 3 years, that's going to be an adjustment for this guy, I'll tell you.
Well, I wondered about that. And because you have, as you said, worked well beyond the time that a lot of folks have gone to the rocking chair.
Right.
But you have enjoyed your life.
Oh, Lord,
work.
yes.
Yeah.
And the best job I've ever had is the one I have now. I wrote something for our college alumni magazine about what we were talking about, and I said, a lot of the guys that did what I did I got up to the chief of staff, to the surgeon general. A lot of those guys go laterally. Well, I've come back down to the line and been able to share 50 years of experience with what I told them is at least two generations of healthcare workers. And it's really rewarding. Plus, we're doing really good work for people that need help.
You've been like a musician who's gone back to acoustic music, right?
You've
been able to go back to the roots.
Absolutely.
Tell us about this lifetime in public health and how things have changed over the years, how our concerns have changed.
Well, when I was an intern in a merchant marine hospital in New Orleans, you had to have a smallpox vaccination because we got people off of foreign vessels. Now you can hardly find one. In those days, the antibiotics were around, but all the vaccines weren't. There was nowhere near as much transplantation and nowhere near the genetic and antibiotic diagnosis and treatment going. We were able to take care of a whole lot of people. This lymphoma that I have, when I was an intern, something like 1 in 20, nearly 20% of them would die from infection. I haven't had any infection, and I'm in my 3rd round of chemo, still have my hair. It's just absolutely different, and the drugs they used on me are the same ones I used in the 70s, but the outcome is so different. And people say, well, you're battling it. I said, no, I'm arm wrestling it. It's more like a chronic disease. People say, well, what do you think? I said, well, it's kind of like dandelions. You spray them this April, you're going to have to spray them again next April. And I'm not nonchalant about this thing, but you can either get a wagon and put your rear end in it and drag it around all day long, or you can keep hitting it, which is what I'm doing, and I love it.
Well, your sense of humor, I think, has been helpful to you along the way, and I'm sure you agree with that, right?
Oh, yeah.
People who have a good attitude tend to do better?
When you laugh, I'm told you produce endorphins, and endorphins make you feel good. And if people that are around me know I enjoy a good time, a good laugh. I think it's a congenital asset because my father grew up here. His name was Brownie Leach. And there are all sorts of stories about things he did and big lies he perpetrated on Lexington, harmlessly, but nevertheless fun, made a lot of fun.
So in having that long view of Lexington and seeing the growth and the changes through the years, and then in your career in public health, what were the concerns that came along? You move into the 1970s and 80s, and times are changing, and so are the challenges for public health, right?
1948, I was 8 years old. We had rabies outbreaks. Dogs were running around with muzzles, and they were running around. They weren't required to be on a leash. We had a bad polio epidemic that year. I know 2 people that had polio. I don't know anybody that died. 2 of my friends caught it, gone. And today, they don't worry about that. In fact, we worry about trying to get people to get their kids immunized because they haven't seen the kind of fear that goes with being exposed to that sort of stuff.
There was a terrible flu outbreak in 1957.
57, I was a junior in high school. If we had that today with people like me running around on chemo and all the organ transplants and all the people with all these new drugs for arthritis and diabetes and stuff that makes you more subject to infection, it's absolutely imperative that people get their flu shots, not only to protect them, but to protect people like me and the little kids that have problems. Those folks did not survive to adulthood. People like me would have had a harder time surviving treatment for malignancy. And in the 1957 flu, we all tolerated it. Well, today's society is much more likely to want nothing to go wrong. Well, things go wrong with these horrible flu outbreaks. So worry about that some.
As again, you moved into then the later decades, the 70s, 80s, the
Yes.
AIDS epidemic came along to America, and Lexington was not immune.
Lexington was not immune, but let me talk about something. Don't let me forget to get back to that.
Yeah.
Between the time I mentioned and the 80s,
Yeah.
we got our arms around communicable disease between immunizations and antibiotics. And the CDC shifted from being the Center for Communicable Disease to the Center for Disease Control and Prevention. And we started getting into other things like cancer and maternal and child health and so on and so forth. And we pulled that public health workforce out of the field and put them in a clinic. We stopped going out to where people live and work and expected them to come see us. So we circled the wagons to do clinical things. And along comes AIDS and HIV in the 80s, and by this time we were beginning to pull our workforce in when the problem was out. So it took a while to get airborne with that. It took a while to get the drugs that work. Now people don't begin to die of AIDS nearly as much as they did. When I was in Phoenix running an Indian hospital, HIV was a death sentence. It's not that way anymore. We got people all over the place that are having perfectly productive lives, taking some expensive medicines, but they have productive lives as a result of it. I think we'll see the same thing with some of these other things that are coming along that look so desperate right now.
And do you think the AIDS epidemic is to a great extent under control at this point, or?
Well, it depends on how you define control, Bill.
Yeah.
I think it was going up like this early on. I guess through your camera, it was going up like this early on. It's not growing as fast, but people still get HIV infected. Fortunately, if they come in and get screened, or we can find them when we go out, we have teams that go out to places that most doctors don't visit to offer screening. We go to the gay bars, the bisexual places, we go where the drug abusers hang out, and we offer screening. And I'm told here recently we've had an uptick in the number of people in those settings who volunteer to get screened. So it's still there, it's still a problem. It's under much better control than it was in 1985, but there's still a lot of work to do.
We learned this week that actor Charlie Sheen has HIV. When a high-profile person like that comes forward, does that raise awareness?
It really does. I was Chief of Staff to the Surgeon General when Magic Johnson announced that he was HIV positive the same week that Anita Hill and Clarence Thomas were having their discussion during his Supreme Court appointment hearing. Yes, somebody like that mentions I've got this, people realize, my God, even those folks can get this. I better worry a little bit more about myself and what I'm doing. So yes, screening goes up. Does it mean there's more of it? I haven't read the data, so I don't know, but it may well mean there's more of it. But it could also mean we're looking a lot more closely and we're finding more of it.
And you provide testing at the health department?
We do, yes.
As people, as we move to present day, and people are living longer, but in some cases the quality of life is not there for a variety of reasons, many of those self-inflicted, some of the problems that we have. We know that certainly drug abuse and smoking rates are quite high in Kentucky. As public health tries to get a handle on that, what is your role?
I guess my role is multiple. It's translator, communicator, facilitator, agitator. You and I have talked about this before, and one thing I mention to you every time I get a chance is that smoking's bad, does bad things to you. Diabetes is bad, it does bad things to you. Cancer's bad, but it does things to you when you're older. suicide, homicide, drug abuse, alcohol abuse, spouse abuse, bullying, and so on, and getting incarcerated. Those conditions are taking out the 15 to 35-year-olds. Those are the males and females that we need to run this society. And public health isn't doing much of anything about that. It can, and I think it will, the same way it did something about polio and TB before we had polio vaccine and isoniazid, which both those happened in 1955, and the rates dropped. What had happened is we, as a nation and the healthcare community, had started working on it. So when the tools came out, ready to go. I think we need to be working on some of these other things to be ready to go, because we don't necessarily have the preventive stuff. We have some of the curative stuff. But if public health and the treatment people and the at-risk population start thinking together, we will come up with an approach that will move it in a positive direction. So I keep pushing that over and over and over again.
As you know, budgets are tight, and
Yes.
People will only be taxed so much. As you look at the challenges we face, do you think that policymakers need to be convinced that public health is an area where more investment should be made and prioritized?
I think that's true, but I also think the public health community needs to take a hard look at what is it doing. Is it doing it as efficiently as it can? Is it sharing as much as it can? Have we got guys with wanting to defend my coffee cup instead of saying, Bill, if you just get 10% bigger coffee cup, I'll give you all of this and whatever money I have, and it will work together. Our department in Lexington lost several $1 million right after I came in as commissioner, and we reduced about 50 staff. You can't tell, your viewers can't tell, because part of what we were doing didn't matter very much. Other parts we had, other entities could take over and help, and we started finding out, gee, if you're a clerk in this clinic, you can also do clerk work in this clinic. Sharing. 1 and 1 starts to equal more than 2, and I think that's coming across the entire healthcare system. I'm a patient at UK. They take very good care of me. But, buddy, I tell you, there's some slack in that system that if they could get relief from rules and relief from a few other things. I mean, when I go to clinic, I have to register at every different clinic. I go to Kroger, they know what beer I used to buy. When I go to Ralph's in Phoenix, they know what beer I used to buy. There's got to be a way to combine some of that and take all that energy that's going into clerical work and applying it to other things. So, yes, public health is a major issue, but public health being efficient and showing that it's willing to work with other people is equally important to my view.
A very interesting perspective. Dr. Rice Leach is with us. He will soon retire as head of the Fayette County Health Department and as Fayette County's health commissioner. We're back in a moment. We'll talk about some current concerns as we head into winter. WKYT's Kentucky Newsmakers back in just a moment. Welcome back to WKYT's Kentucky Newsmakers. We're meeting with Dr. Rice Leach, who is Lexington's health commissioner, who will soon retire. Your time frame is when they find somebody to take your place, essentially, right? Yeah,
I will leave when they have a replacement, or I will leave if I get sick and can't serve. But so far, I'm waiting on a replacement.
What are you going to do?
I don't know. I think I have a lot to offer, and I was kidding with you off camera about being a pain in the neck and writing op-ed pieces. But I have got 50 some odd years of watching in multiple countries in the Americas, and I've got a lot of experience trying to share what I've picked up with the younger generations in this game. So I would like to be involved somehow, but I doubt if I'll be full-time in anything. In fact, I'm certain I won't be.
But outspoken from time to time.
Well, yeah, like I told you, it's a congenital asset, sometimes defect. But
the Centers for Disease Control and Prevention released some numbers this week indicating an alarming jump in STDs, chlamydia, gonorrhea, syphilis. What's leading to a trend like that, and are we seeing it locally?
I'm going to give you an honest answer. I don't know the answer to either one of them, but I can give you some thoughts on it. One way you get an increase is if people start being more careful about diagnosing. When I was an intern, chlamydia was not something you could diagnose and not something that we knew a whole lot about treating. Now we can do both. Now, since we have a treatment and we have a quick way to diagnose it, it's the leading cause of sexually transmitted diseases. And 50 years ago, it was not on the radar. So more careful measuring of what's going on is there. It is possible that there are people who are being less careful about unprotected sex. That's not a good idea for these reasons: HIV, hepatitis B, hepatitis C. All of these things can be transmitted sexually. And we were talking about the heroin and the needles earlier to somebody, and people don't realize that you can get hepatitis B and C from a needle, but you can also get hepatitis B and C from a penis. So you've got to protect yourself from that infection with both those routes.
You are encouraging people to get flu shots.
Yes.
It wasn't a good match last year, but you say it is still the most effective preventive
It is, and even if it doesn't prevent it, sometimes it makes it less severe. And last year we had 2 strains of flu, and we had a vaccine that was good against one of them. So last year I was saying we got Cadillac flu and Lincoln flu. If you got Cadillac flu and a Cadillac shot, you're in good shape. If you got Lincoln flu and a Cadillac shot, it won't help. But it does help. It helps reduce it, and it's important to the people that get the vaccine. It's important to people like me on chemotherapy, and it's important to kids on immunosuppressives, and it's important to people with organ transplants. And if you watch the nightly news, you see all these drugs being advertised that say may increase your susceptibility to infections. Well, infections, folks, includes flu. So immunize yourself to protect yourself, and immunize yourself to protect me and guys like me.
And just so that the workforce is able to get in, right?
Yeah, it's hard to go to put out a fire if a third of the firemen are home sick.
And we've had times when healthcare workers themselves
I had a situation where a third of my hospital staff was home sick. It's hard to run a good hospital that way.
What message do you have to people out there to stay as healthy as they can be, to try to follow best practices so that, you know, to the extent we have knowledge, use it?
Take good care of yourself. I don't know how to exactly word that. I tell you, men, best thing you can do once you get over 50 is make sure your cholesterol is under control and your blood pressure is under control. And that's one of the things that aggravates me about this lymphoma. I have taken pretty good care of myself. This carcass is in pretty good shape, except for this thing. But maybe the fact that I took good care of myself is why I've had relatively little trouble with the treatment for this thing. Guys, it's really so simple. Exercise, do lots of things in moderation, and protect yourself from infections. Wash your hands, for crying out loud. Protect yourself if you're messing around sexually. Don't take risks. I mean, most people know that there's a risk, but they say, well, that worries me. People are worried about flying airplanes these days because of the bomb over in Egypt. These are the same guys texting, driving down a highway, reading about the bomb in Egypt. Where's the greater risk to you, the guy texting on the highway? It's just use common sense. I talk over and over again about how my grandmother, who was born in 1876, I do not even know whether she finished high school. But that lady knew how to can food safely, she knew how to raise kids safely, and she knew how to teach little boys like me not to be bad boys when you grew up. Punishment was there and appropriate, and most of it worked.
What should your successor know going forward in leading public health in Lexington, Fayette County?
He should know, she should know. There's a wonderful team there. There's a wonderful city here. There are problems there. This city, in my observation time, has begun to come together in ways that it didn't do that 20-some-odd years ago when I was the commissioner in Frankfurt. I tell people it's the best job I ever had. Because if you like being on the line, now if you want to be up at the top of the pyramid and hobnob with the Surgeon General and find out better ways to walk, this isn't the job for you. But if you want to meet the people who do the work, earn the money, it generates the tax, it pays the bill, and take what we know scientifically and apply to what they want and what they're willing to do, and nothing like it. It's got to be like being a news anchor as opposed to the corporate director of the network in New York. You're here because this is where it's at. And they're up there, it's a different where it's at.
Well, we appreciate you coming in and all the many years that you have come in and been so forthcoming, and hope that we'll hear from you from time to time after your retirement.
Odds are pretty good that'll happen.
And good luck. All right. Dr. Rice Leach, the longtime Lexington Health Commissioner who has worked in public health really for a lifetime, and we appreciate it. We're back on WKYT in a moment, and we will hear from Governor Steve and First Lady Jane Beshear in their closing days in the Governor's Mansion. Back with that interview from Jennifer Palumbo of our staff in just a moment. Welcome back to WKYT's Kentucky Newsmakers. And as you know, Kentucky's Governor-elect Matt Bevin is putting his new administration together. And Kentucky Governor Steve Beshear will wrap up his second term in office soon. He and First Lady Jane Beshear will move out of the governor's mansion on December 7th and begin a new chapter in their lives. This week they sat down with WKYT's Jennifer Palumbo and reflected on the last 8 years and on their future.
It's beginning to look a lot like Christmas at the governor's mansion. But for the first time in 8 years, Steve and Jane Beshear will not celebrate the holiday here.
Whether it's the staff that's here at the mansion, whether it's the security that are with us day in, day out, all of the people that work in the governor's office and around me, and we're like a family, and we're going to miss that family.
The people of this state have given Jane and me the greatest honor that you can bestow on a Kentucky couple, and that's to let me be governor and her to be first lady. And we hope that we have performed the way they want us to. I know that it has been probably the most challenging thing we've ever done. It's been the most rewarding thing in a way that we have ever done. And it's been an exciting time to see what decisions you make can do to help people and improve their lives. And I think we've accomplished a lot. I think we're going to leave Kentucky a lot better off than where we found it.
The governor takes pride in issues from job creation to health care reform. Kentucky's unemployment rate is the lowest in 14 years, and 500,000 Kentuckians have health care coverage for the first time through Connect, the state-based health exchange.
More often than not, I've been able, particularly in the last 3 or 4 years, to bring the two sides, the Republican Senate, the Democratic House, together and work together and get a lot done. And when you look at the list of things just in the last year or two we've been able to pass with domestic violence protection and booster seat requirements for our children, and the dropout age that Jane was so persistent and got done. You know, a lot of good things have happened in Kentucky.
When you're in a position like this, you really do have a bully pulpit. And I decided to take advantage of that for the areas that interest me the most, and that's health, education, and tourism for our state. And I felt like those were areas that I could play a major role. And just because we're in this position, people will listen to you. So it's been great from my perspective. You know, we were able to raise, finally, after many years, the dropout age from 16 to 18. We finally got dating violence legislation passed. And I guess one of the great things that I've thoroughly enjoyed is my Horses and Hope program, where we paired breast cancer awareness and education with the horse, which is my passion. And we have been able to provide mammograms for people that work on the backside of the track. That has increased even more. I've just completed raising over $1 million for a mobile unit that will travel throughout Kentucky, providing screenings, education, awareness, and screenings for 7 different kinds of cancer. And it will be an opportunity to really change the landscape.
It's amazing, the laundry list, when you look at what this lady has done. All the things she's mentioned, obviously, but preserving this mansion. She raised $1 million and put it in an endowment to take care of this mansion for generations to come. She renovated the old governor's mansion to preserve it. The kinds of things that she's done in tourism with the Dawkins Trail, going to be one of the longest trails in the country up in eastern Kentucky to attract tourists. It's been amazing what a great first lady this gal is.
And I've had a good time.
The governor says he hopes his successor, Republican Governor-elect Matt Bevin, will reconsider his campaign promise to block Medicaid expansion and eliminate Connect.
The studies that we have so far, all the facts say, yes, we can afford it for the next few years. But what do I advise anybody to do? Keep looking at it. As we go along, keep looking at it. If we ever reach that point to where we can't afford it, then you can make another decision.
Married 46 years, the Beshears can't wait to spend time with their 3 grandchildren. Their son Andy Beshear was just elected Attorney General.
We'll have time to spend with our grandchildren. We have 3 grandchildren, so we're looking forward to getting back to soccer games and ballet recitals, and a lot of things that we have not had as much time for that we will now be able to invest more time in that. We love to travel, and we're looking forward to having some opportunities to, to complete our bucket list. We still have a number of places on the bucket list, and we have a farm on the southeast side of Lexington that I love. And so looking forward to spending time there. I think Steve's looking forward to spending a bit of time on the golf course. That's his passion. And actually just taking some time to relax.
But at 71, Steve Beshear says his days of running for office are over.
I'm pushing Jane to run.
And I am not.
No, we're not going to be up for public office again. We've done our thing there, and I mean, what greater position is there than being governor of Kentucky, to be honest with you?
In Frankfort, Jennifer Palumbo, WKYT.
And our thanks to Jennifer Palumbo for putting that segment together with the Beshears. We want to thank you very much for joining us for this edition of Kentucky Newsmakers. I'll see you bright and early this week on WKYT This Morning. We begin at 4:30 a.m., on mid-morning at 10, and on WKYT News at noon. Follow Kentucky Newsmakers on Twitter for political updates. Have a happy Thanksgiving week ahead, everybody.